Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist. A friend of mine asked me what is the best way to find out if somebody has a heart disease, such as blockage involving the coronary artery disease that causes chest pain, shortness of breath, and other symptoms. So I thought maybe I make a video on this one and go over some of the tests that we routinely do in order to determine if somebody has a blockage in the coronary arteries. If so, where are the blockages and how significant is the blockage? Is that blockage compromising the blood circulation to the heart muscle? What is the status of the heart muscle? Is it viable? Is it a scar? Did the person have a heart attack before? And how is the heart pumping? The overall function of the heart. So we can determine all these things with fairly simple tests. So I'm going to try to explain to you the different types of tests that we do in order to pinpoint the diagnosis of blockages in the coronary arteries or the coronary artery disease, and also determine how significant the blockage is and the circulation beyond the blockage. So let us begin with this feature presentation. There are various ways in which we determine the presence of a blockage or reduced circulation to the heart muscle, which is known as atherosclerosis. The simplest thing is a treadmill test. You can follow my arrow here. A treadmill test where we exercise people on the treadmill. We monitor their blood pressure, we monitor their heart rate, heart rhythm, and look for EKG changes during the exercise to see if there is reduced circulation to the heart muscle, and also look for symptoms or irregular heartbeats. That's the simplest test. You can set up a test. You need to be fasting for 4 hours before you do the stress test. No other preparation is needed. You are connected with all these electrodes and placed on a treadmill, and a graduated exercise program is done in order to determine if there are any changes in your blood pressure, heart rate, heart EKG changes, and any extra heartbeats. Based on that, we'll see if you have any significant coronary artery disease. The second type of test that we routinely do in a hospital setup or in a doctor's office is known as the nuclear stress test. So we can either do a treadmill stress test or a chemical stress test to increase the blood circulation to the heart muscle that is combined with a nuclear scan of the heart. And I'm going to show you some pictures and show you the differences. And that will help us to not only look at the blood circulation to different regions of the heart muscle. With the nuclear stress test, we not only can determine the reduced circulation to a given particular region of the heart muscle, we can also see how significant the blockage is. It also allows us to find out if there had been a previous heart attack and if the heart is enlarged, or if there is reduced heart function. So nuclear stress test can give a lot more information about not only the coronary artery blockages, but also the status of the heart muscle as a pump. The main function of the heart is to pump blood, and the blood circulation is one of its oxygen supplies, but the main function is pumping, and that can be determined to see if there was any scarring of the heart from a previous heart attack or inflammation, or if the heart was enlarged due to valvular heart disease, something like that. So there are a number of points that we can infer from a nuclear stress test, which we can't do from a regular treadmill test. We also do an echocardiogram combined with a treadmill exercise test or a chemical stress test like using dobutamine. With stress echocardiography, there are more steps involved, and you need a highly skilled echocardiography technician to acquire the images within the 90 seconds after the exercise. So you compare the rest heart images with the exercise heart images. It is similar to the nuclear scan, except we are looking at an ultrasound of the heart rather than a nuclear image of the heart muscle itself. So that's a different kind of test, and it is also very fairly accurate if it is done properly. but most centers may not have the facilities to have the sophisticated machines and also people who are highly skilled and trained to do the stress echocardiography. But more nuclear tests are actually done in most places across the country. 8 million nuclear tests are done each year. So that is the most common one done other than a treadmill in order to determine the location of the blockage, the degree of blockage, and the status of the heart muscle beyond the blockage by looking at the myocardial, the heart muscle blood supply. Along the same lines, we also have the third category, which is the PET scan, PET CT. The beauty of the PET CT is that the PET CT has a much better resolution compared to the nuclear images, and this can be done using a CT scan which looks at the calcium score, which some of you have heard about, so that CAT scan also looks at the blood circulation in terms of how much blood circulation is improved with medications that we give to dilate the blood vessels. As a result, the PET CT scan is supposed to be one of the best modalities available in order to determine the location of the blockage, the degree of the blockage, the amount of blood circulation reduction in that region from the blockage, the status of the heart muscle itself. Is the heart muscle viable? Is the heart muscle a scar? So there is a ton of information that we can derive from the PET CT scan, but by the same token, the PET CT scan is the most expensive test, and it involves the number of highly skilled people. It is not something that you can have it in every community hospital or a doctor's office. Some of them do in big cardiology practices, but it is a highly sophisticated process. Major hospitals do have access to this, especially the medical center hospitals have access to the PET CT, which is sort of like the ultimate test that we can do before doing an angiogram to see if the blockages that we see on these are actually real or not. So let us dive a little deeper and understand as what are the differences, major differences among these three tests. The stress test basically looks at the electrocardiographic changes, especially the ST segment, see if it's down, and this is an abnormal response to an exercise test. Whereas the nuclear scan looks at the blood myocardial circulation. This is the heart muscle itself, which takes up the isotope, and then it outlines the heart size and function. And based on this, if it's uniformly orange like this, that means the circulation is normal. If there's a blue missing area, that means that's an area where there is scar or the heart muscle is stunned. The difference between the nuclear and the PET scan is the image quality is far superior with the PET scans compared to the, you see this kind of so fuzzy, whereas this is very clear because of the isotope that is used. Another advantage I want to tell you about the nuclear stress test is the PET CT scan is, this is something it can be done. You don't have to exercise. Everything is done by using chemicals. The whole test can be completed in 30 minutes, whereas the nuclear stress test may take, you do a resting heart scan, do exercise or use a chemical to improve the blood circulation, and then you inject the isotope. You do a second heart scan, then you look at this like the stress and the rest images. It's the same thing that is done here, but using a chemical as the main stressor agent. As a result, the nuclear stress test may take 4 to 6 hours, or at least 4 hours minimum, whereas the PET scan can be completed in 30 minutes. And both of these procedures will need an intravenous line setup for administering medicines and also for administering the isotopes. There are several advantages to PET CT, some of which I already mentioned. Number one is PET CT has a far better resolution compared to the nuclear scan. Number two is it can look at the blood circulation reserve during exercise. Not only does it show that there is reduced circulation, but it also tells us how much is the reduced circulation. So, and here is an example of a scar which is showing this heart muscle has been replaced by a scar. And as you can see, we can also look at a heart muscle that is kind of stunned, but it's not completely like a scar. That is known as hibernating myocardium. So we may have critical blockage here, and the heart muscle may be getting just like a trickle of blood, and the muscle is still viable. And if we restore the circulation, then the heart would completely recover its function, just like as you can see here. And it also shows if there was a heart attack. If there is a heart attack, then it has a much better resolution to show if there was a previous heart attack resulting in a scar tissue. Another advantage of the PET CT is we can look at the calcium score, which I mentioned on the CT scan, and if the calcium score is high, the chances are it is significant. One of the most important aspects is to see how much is the reduction in the blood supply in an artery that is blocked in a PET scan compared to an angiogram, and how much can we improve the circulation by giving these medications to improve the blood flow to the heart muscle itself. So there are a lot of advantages with the PET CT, but by the same token, it is the most expensive test, and it involves a lot of technical help to do the tests. A normal treadmill may cost approximately $400 depending upon where it is done. Whereas a nuclear stress can range from $738 to I have seen as high as $8,000. The hospitals charge a lot more and get away with it. I have no idea how they can do it. And as I told you before, 8 million nuclear stress tests are done every year. So this is one of the most commonly done tests. It can be set up in any community hospital. I had a nuclear stress test in my office while I was in full-time practice. And this is something that can be done in any small setup. Whereas PET CT scan is a much more sophisticated test, and it needs experts in reading these tests. It can range from $1,200 to $2,000, or maybe as much as $10,000. It all depends upon whatever that place can charge and get away with it. Keeping that aside, from a perspective of finding out, what is the best way to see if there's a blockage in the artery, there are different modalities of tests that are available. And the CT scan is another one, where CT angiography, you might have heard of CT angiography, where a contrast is injected into the vein, and that contrast is lighting up the coronary arteries. As we can see here, it lights up the coronary arteries like this, and there we can actually see how significant the blockage is. So CT angiography is one of the best ones, short of putting a catheter in the heart and injecting the contrast right into the coronary arteries. But by the same token, CT angiography may not be reliable if there is a lot of calcium overlapping the blockages. But still, it is one of the best ones that can be done. Nuclear PET scan comes next to that. So, ladies and gentlemen, if you look at the diagnostic accuracy of all these various tests, we can see that PET CT has the best performance in terms of determining if there is a blockage in an artery that is compromising the circulation to the heart muscle. And here is the orange one, which is the PET scan, which has the best ability, almost 85%, to determine the degree of blockage and the status of the arteries beyond the blockage. So, ladies and gentlemen, in summary, this is a quick synopsis of what kind of tests can be done and what can we infer from those tests, and what is the most accurate way to diagnose the blockages in a coronary artery. It all depends upon your age, your symptom, your associated medical conditions, your ability to exercise, and the facilities available in your location to get these tests done. I live in Houston. in the medical center. So all these facilities are available. Again, it is determined by your cardiologist after taking your complete history, evaluation, examination, electrocardiogram, echocardiography. After all these tests are done, then your doctor will decide as to what is the best way to find out if you do have a critical blockage. If so, where is the blockage, and what is the status of the blood vessels beyond the blockage? How is the heart muscle doing beyond the blockage? Does the blockage needs to be fixed because it is compromising the circulation? All of this information can be derived non-invasively without putting a catheter in your heart. I hope this has been useful and educational to you. Thank you so much for watching this. And I have more than 300 videos of public interest with reference to heart disease. Please do watch them, and please do subscribe to our YouTube channel. And I will see you in the next presentation. I am Dr. NIK NIKAM. You have been listening to treadmill test, nuclear test, or PET scan to determine the blockages in the coronary arteries. Thank you so much.